Yeah, hello, good morning, everyone. I believe you are doing well by the grace of God and Allah. So, today we come to your home once again with a very interesting topic as far as first aid is concerned. This morning, we'd want to quickly go through a medical condition termed as shock. Mostly, people would want to mistaken shock in relation to other occurrences, but this morning the shock we are trying to discuss is a medical condition. So what is shock in definition? So when we talk about shock is basically a deprivation in a vital organ, and the vital organ we are much interested in is a part of the brain which is known as the oblongata. So it helps in the regulation of how body processes takes place. So what would contribute to one even getting a shock? So shock usually comes about when we take the internal organs of the body. You'd realize that as part of the functionalities, the brain coordinates the activities of other vital organs. So even before the heart would be able to pump blood adequately, and then the lungs also helps in the exchange of gases, meaning that the nerve supplies to these organs are well coordinated by the activity of the brain. So if there is any problem relating to the brain, then this problem would also contribute to the inadequacy of these vital organs to function. So the circulatory system would find it so difficult pumping adequate blood to the entire body part, including the vital organs. And then the fascinating part of it is that the heart itself also have structures that supplies itself with blood. So just imagine the heart is also not receiving the adequate blood. Then with time, the heart would lose its contractility, the ability to contract, and then blood supply becomes impeded or a problem. So in effect, we would want to say that basically shock occurs when there is a reduction in blood flow, and then this reduction in the blood flow would also contribute to the fact that blood supply to internal organs and other body tissues would also become diminished or lessened. And we know that the blood contains adequate nutrients, and then it contains oxygen. And these nutrients and oxygens are really important as far as the survival of cells is involved. So just imagine the body tissues and cells not getting the adequate oxygen supply and the nutrient. With time, these cells would die, and then the individual wouldn't be able to function. It can finally contribute to death. So that is just an introduction. So in effect, the pathophysiology is that any condition that would, one, contribute to either a loss of blood from circulation or any medical condition relating to pain that would also in effect contribute to loss of blood from circulation, or any condition that would affect the brain, whether a spinal cord injury or whether even fear, anxiety. And then the individual is so tensed, and then the brain is unable to pick up its normal function, would in conclusion bring about the condition of shock. So please stay tuned and then watch for the subsequent episodes with which we would elaborate much as to the types of shock, and then the stages of shock, and finally the management of shock. Thank you very much.